Hello, I'm Dr. Jay Keener, Chief of Washington University Orthopedics Shoulder and Elbow Surgery Division. Thank you for choosing Washington University Orthopedics for your care. Our goal is to get you back to doing the things you love, and WashU's Ortho's care team is here to provide you with the knowledge you need to succeed as you prepare for surgery and recover after surgery. Our department has a long history of helping patients achieve their goals. We use the latest research and advanced technology to bring you an innovative approach to your surgery and your recovery. Your journey guide will be a helpful tool in your recovery, so please keep it within easy reach for reference at home. Once again, thank you for choosing Washington University Orthopedics for your shoulder arthroplasty surgery. We look forward to providing you with extraordinary care.
Thank you for joining Washington University Orthopedics to learn more about shoulder replacement surgery, also known as shoulder arthroplasty. This video series is intended to help you prepare for surgery and plan for your successful recovery. So what is shoulder replacement? It's a surgical procedure designed to relieve pain and improve function in patients with shoulder problems or conditions. The primary reason to have a shoulder replacement is to alleviate pain. For most patients, your range of motion and shoulder function should improve as well. A shoulder replacement consists of metal and plastic pieces strategically placed in your shoulder to correct degenerative conditions like osteoarthritis, which is the name for wear and tear arthritis. There are two types of complete or total shoulder replacements. The first is an anatomic replacement. This consists of a metallic humeral head, which is the name of the rounded top of the upper arm bone. This connects with a plastic piece cemented in place to resurface the socket, called the glenoid. The most common reason to perform this surgery is osteoarthritis, where there is painful bone-on-bone contact within the joint. For an anatomic replacement to function well, the rotator cuff tendon should be intact and healthy, and there must be enough bone available within the socket. Another type of shoulder replacement is called a reverse shoulder replacement. It is a type of replacement where the joint is reversed. The ball side becomes the socket, and the socket is resurfaced with a ball. This replacement is also made of metal and plastic, and it changes the basic mechanics of the shoulder. Due to the altered mechanics of the shoulder, after reverse arthroplasty, the deltoid becomes stronger and the shoulder becomes less dependent on the rotator cuff muscles for shoulder function. Unlike the anatomic replacement, the reverse replacement is used to treat a variety of shoulder problems, including osteoarthritis with a rotator cuff tear, failed rotator cuff repair surgeries, rotator cuff tears that are felt to have a low likelihood of healing with surgery, and certain fractures around the shoulder. The reverse replacement is also commonly used to replace prior shoulder replacements that have failed. Both the anatomic and reverse shoulder replacement are very reliable for pain relief. There are slight differences in shoulder function between the anatomic and reverse replacements that your surgeon can explain. With both surgeries, an active lifestyle is possible and encouraged. Common activities after shoulder replacement include golf, tennis, swimming, hunting, fishing, and lightweight training. Following shoulder replacement, most types of employment are possible, including light and medium physical labor. Shoulder replacements are not designed for heavy physical labor. When you meet with your surgeon and surgical care team, they will ask for a detailed health history, physical examination, and x-rays of the shoulder. Although your surgeon can often make a diagnosis with x-rays, other examination tests may be needed to assess the severity of the condition, disease, and associated problems. The two most common tests are a CAT scan and MRI. Your surgeon may use a CAT scan to further evaluate bone shape or deformity in shoulders affected by arthritis. An MRI or ultrasound may be used to assess your rotator cuff muscles and tendons. Your surgeon's office will likely reach out to your primary care doctor to obtain clearance for surgery. This is done to optimize your health before surgery so you may have the best outcome possible. Your primary care or specialty doctors may need to evaluate you before surgery. This is especially true if you have heart or lung disease. There are several contraindications or reasons not to have surgery that must be addressed before surgery. These include active infections such as bladder or urinary tract infections, pneumonia, or sinus infections. And surgery should not be performed when there are open skin sores. All of these factors need to be in control to protect you from complications around the time of surgery. Hospital policies around COVID-19 are often changing in regards to elective surgery. You cannot have the surgery during an active COVID infection. If you are on blood thinners, there are special considerations. All blood thinner medications must be stopped prior to surgery. These medicines are resumed after surgery. Patients take blood thinners for a variety of reasons, and each medicine has a different action in the body. Your surgeon's office will work with your prescribing doctor or specialist to develop a blood thinner plan that is appropriate for you. These instructions will be clearly explained to you by your nurse from the surgeon's office. For patients who resume blood thinners, there will be more bruising than typical, and there is a slightly higher risk of a hematoma formation under your incision. Some rheumatoid medications decrease your immunity and can increase the risk of infection. Please discuss these medications with your surgeon team prior to surgery. We will work with your prescribing doctor to develop a treatment plan. You will be asked to stop the following medications 7 days before surgery. A joint coach is needed to assist you with your recovery and should be chosen prior to surgery. This is usually a family member or close friend. Your joint coach is someone that needs to be available to help you at home, and they also need to be present on the day you are discharged from the hospital. Your joint coach will be educated regarding various aspects of your recovery, and you will likely need assistance from your coach with managing your shoulder dressing and pain catheter. Your coach will also assist with bathing and getting dressed, managing your ice therapy, supervising your exercises, and helping prepare food. All patients undergoing shoulder replacement need to be evaluated in the anesthesia workup clinic known as the Center for Preoperative Assessment and Planning, or CPAP. This appointment is made for you within 30 days of the surgery by the nursing staff of your surgeon. The purpose of the anesthesia workup visit is to review your medical history, current health and current medicine list. During this workup, you will likely have routine blood work, possibly an electrocardiogram, or EKG, or chest x-ray. The providers at this clinic may reach out to your specialty doctors as needed. They will also educate you regarding which medicines to hold prior to surgery and which to take on the morning of surgery. Check in with your primary care doctors and any specialist, such as your heart or lung doctor. In some cases, your primary care or specialty care doctor may need to evaluate you before surgery. Schedule an appointment with your dentist before surgery to make sure your teeth and gums are in their best health. Healthy teeth will help lower the chances of infection after surgery. If you need to have any dental work done before surgery, you must notify your surgeon's office as soon as possible. After your surgery, you need to wait at least 3 months before having any routine or elective dental work, such as teeth cleaning. Preventative antibiotics are recommended for at least the first 2 years following your joint replacement before any dental appointments. Please notify your surgeon's office of any future dental visits so you can be provided with the appropriate antibiotic. We recommend that you stop using all nicotine products before surgery. This includes cigarettes, nicotine gum or patches, chewing tobacco, e-cigarettes, and vaping products. Your body will recover faster. You will have lower risk of infection by not smoking around the time of your surgery. Please contact your surgeon's office or refer to your journey guide for smoking cessation resources. In those with diabetes, blood glucose control is needed. A blood test called hemoglobin A1C will be performed prior to surgery. In order for you to be able to proceed safely with surgery, your hemoglobin A1C needs to be under 8. Uncontrolled diabetes can lead to delayed wound healing and an increased risk of infection. Maintaining a healthy diet, and lifestyle is very important to your recovery. Eat well-balanced meals consisting of fresh fruits and vegetables as well as lean proteins. Examples of lean proteins are beans, lentils, and fish. Make sure you are staying well hydrated before and after surgery as well. Please do not consume any alcoholic beverages for 72 hours before your surgery. There are simple ways you can prepare your home before surgery to ensure you have a safe environment in which to recover. Move commonly used items in your bedroom, bathroom, and kitchen to within arm's reach or within waist level. Remove trip hazards such as throw rugs, extension cords, and toys. Tackle household chores before surgery such as cleaning your home and laundry, or enlist some help for afterwards for yard work, caring for your home, children, or pets. Make sure all stairs inside and outside of your home have a sturdy railing. Make sure all areas you walk in are well lit. Change burnt out light bulbs, and if needed, add extra light to see. Pre-make and freeze healthy meals for easy food preparation during the first days after surgery. You will shower the night before surgery and the morning of surgery. First, wash your hair using regular shampoo. Do not use conditioner in your hair. After you rinse your hair, shower with special surgical soap given to you by the nurses. Apply surgical scrub with a washcloth and keep the soap on your skin for 2 minutes before rinsing it off. Don't use the scrub on your face or genital area. Then use a clean towel to dry off. Do not put deodorants, lotion, or powders on your skin after showering. Make sure you sleep in clean pajamas and sheets the night before surgery and don't allow pets in your bed. Do not eat any food after midnight. In some cases, you can drink clear liquids on the morning of surgery. This will be explained to you by your surgeon's team or providers in the anesthesia workup area. For your stay in the hospital, remember to pack appropriately. You should bring a set of loose-fitting clothing for when you are discharged, such as a loose or oversized shirt with a wide neck, elastic band pants, and slip-on shoes. If you have dentures, glasses, and hearing aids, bring those as well. If you use a CPAP machine when you sleep, bring this device with you on the day of surgery. Do not bring valuables such as jewelry, watches, or money with you to the hospital. On the morning of surgery, please take only the home medications that you were instructed to take from your preoperative testing visit. You should take these medicines with small sips of water only. You should shower with the specialized surgical scrub according to the instructions given to you at your preoperative visit. Do not use deodorant, lotions, and other products on the day of surgery. Please remove all rings and body piercings before arriving to the hospital. Please arrive on time to the surgical suite to avoid any delays. The check-in location will be communicated to you by your surgeon's nurse. After you check in, you and a family member, care partner, or joint coach will go to the holding area. You will change into a gown and an IV will be started. Here you will meet your anesthesia providers. Your surgeon will also meet you in the holding area. Prior to the surgery, your anesthesia doctor will discuss performing a general anesthesia and regional anesthetic procedure. Refer to our educational video explaining how the regional anesthetic procedure will help with pain after the surgery. Your surgical procedure will last approximately 90 to 120 minutes. Your surgeon will update your joint coach or family after the procedure by phone. You will spend time in the recovery room after surgery, and x-rays of your shoulder are typically performed while you are in the recovery room. After surgery, your arm is placed in a sling, sometimes with a pillow. An ice therapy pad will be placed on the shoulder and should be used continuously to reduce swelling. Ice therapy is used to control inflammation and help with pain control. The nursing staff will help you get in and out of bed and will assist you to the bathroom on the day of surgery. After the surgery, you're allowed to eat and drink, but the process is slow to avoid nausea. Intermittent compression devices are used to promote your blood circulation and provide prevention for blood clots. A breathing device called an incentive spirometer is used to prevent respiratory complications such as pneumonia. It is recommended that patients complete their breathing exercises 10 times during every hour while they are awake. Make sure to bring your incentive spirometer home when you are discharged so you may continue your breathing exercises. We will work with you to help manage your pain. Having pain after surgery is expected and normal. You will be asked to rate your pain using the 0 to 10 pain scale. Our goal is to keep your pain within a tolerable range, which falls in the low to moderate pain levels when using the pain scale. During your hospital stay, your care team will help manage your pain by combining different methods like ice therapy, relaxation, repositioning, and medication. Please use your call light to let your care team know when you start feeling uncomfortable. This will help us to be proactive in keeping your pain within a tolerable level. A variety of methods are used to control your pain after surgery. The regional anesthetic procedure is very effective at controlling pain, especially on the day of surgery. Ice therapy is used to control inflammation and help with pain control. On the day of surgery, the nurses will give you acetaminophen on a regular basis. When you begin to feel pain, oral narcotics are used to bring your pain in the tolerable range. Stool softeners will be prescribed to help manage the constipation associated with narcotic use. For men, we give medicine to assist with urination, as the effects of anesthesia can make it difficult to urinate after surgery, especially if you have a history of prostate problems. During your surgery, your surgeon must cut the front rotator cuff tendon to gain access to the joint. This tendon is securely repaired at the end of surgery, and you must protect this repair to have a good outcome after surgery. In order to heal properly, there are 3 physical restrictions you need to remember. Do not reach behind your back. Do not bear weight on your elbows or hands. This is especially important when getting out of bed or out of a chair. Do not lift more than a pound with your operative arm, even if there is no pain. To help educate you on the physical activities and exercises, you will be evaluated by an occupational therapist during your hospital stay. The therapist will educate you on appropriate exercises to perform at home. They will review with you how to remove and replace the sling, and they will teach you strategies for dressing and self-care. Also, your therapist will review with you restrictions that are important to protect your shoulder during early recovery. You may also meet with a physical therapist to assess your safety when walking and transferring in and out of bed or a chair. This is usually more applicable to those with lower extremity weakness or when balancing problems are a concern. You must pass the therapy before you are discharged to home. In terms of shoulder exercises, there are differences in rehabilitation process between anatomic and reverse replacement. For both anatomic and reverse replacement, you will learn elbow, wrist, and hand range of motion exercises. For anatomic replacements, we allow early protected shoulder range of motion at home. Formal physical therapy does not typically begin until 6 weeks after surgery. For reverse replacements, shoulder range of motion is avoided until 3 weeks after surgery, and then physical therapy is started at that time. Some patients may be discharged on the day of surgery. This will be discussed with you during the surgery planning phase. Criteria for discharge includes that you have adequate pain control, you have completed occupational therapy, you can eat, drink, and urinate, and all drains, if placed, are removed. If you are staying overnight, your joint coach should plan to be in the hospital early in the morning and be with you prior to discharge. If someone other than the joint coach is providing your ride home, please inform them to come early on the day of discharge. Our goal is to discharge you before noon on the planned day of discharge. Develop a plan of care with your caregiver for after surgery ahead of time. Some patients are not safe to be discharged directly from the hospital to home. Physical and occupational therapists help your care team determine which patients need an alternative discharge pathway. In most cases, these reasons relate to difficulties with balance and weakness of the legs or feet. In order to be discharged to home, you must be able to get out of bed and a chair without bearing weight on the surgical arm. If you have trouble getting out of or transferring out of a chair, you may be discharged to a skilled nursing facility. Medicare and most insurance providers require a 3-night hospital admission prior to discharge to these facilities. If you need an alternative discharge pathway, a social worker will work with you or your family to find a facility suitable for your needs. If you live alone, please arrange home assistance from friends or family before you have your surgery, as most insurance carriers will not pay for skilled nursing after shoulder replacement surgery. The lack of home support is not an acceptable reason to qualify for an alternative discharge facility. After your shoulder surgery, you will use a sling to protect your shoulder. The types of slings that are used after shoulder replacement surgery are different for anatomic and reverse replacements. With an anatomic replacement, you will receive a sling with no pillow. With reverse replacements, you will typically receive a sling with a pillow for additional protection. It is important to follow the sling instructions you learned while in the hospital. Do not bear weight on the arm or reach behind you. For all types of arthroplasty, you can spend some time out of the sling as long as you are sitting or resting in bed, but you should have your arms supported on pillows. You should wear the sling when you are up and moving and at nighttime. Pay attention to your restrictions. No weight bearing, do not reach behind your back, and no lifting more than a few pounds with your hand. Blood clots or deep vein thrombosis can complicate any type of joint replacement. Even though there are risks of blood clots are less with shoulder replacement than hip or knee replacement, these can occur. Your general activity level after surgery are more important than medications to prevent a clot. You should walk short distances around the house at least 8 to 10 times each day. To further prevent blood clots, most patients are placed on baby aspirin twice a day for 2 weeks. Higher risk patients will be placed on a stronger blood thinner medication as needed, usually for 4 weeks. Always wash your hands before and after caring for your incision. Your sutures are dissolvable and mostly under the skin. The incision is reinforced with tapes called steri strips. If you have a bulky dressing over your incision, remove this on day 5 after surgery, but keep the steri strips in place. You may shower after day 5 and after the dressing is removed. If you have a clear dressing over your incision, do not remove until your first post-operative visit. Clear dressing is waterproof. Don't soak your incision in water or submerge your shoulder in the bathtub or a pool. After dressing removal, you may notice bruising and swelling. This is normal. Often the bruising will track down the arm into the chest or down your torso due to the effects of gravity. Family and friends should clean their hands with soap and water or an alcohol-based hand rub before and after visiting you. If you do not see them clean their hands, ask them to clean their hands. Ice therapy is very helpful after surgery to reduce inflammation and pain. We recommend that you use ice therapy continuously for the first 3 days after surgery. After this period, use cold therapy 2 to 3 times per day for about 30 minutes. A good time to do this is following your exercises. Application of cold therapy is a good idea prior to sleep. Pain relief at home is provided with a combination of ice therapy and medicines. The first line of treatment for pain should be cold therapy and prescribed NSAIDs. Make sure to follow instructions for taking prescribed and over-the-counter medications. Narcotic pain medicine should only be taken when you feel that the pain is intolerable and interferes with your daily activities. It is strongly recommended to reduce the frequency of use of these medicines as your pain improves, as these medicines have many side effects and have an addictive potential. Most patients can cut back on these medicines within 3 to 4 days after surgery. These medications are most helpful when taken prior to sleep. When you are running low on these medications and need a refill, please give us a notice in advance so we have enough time to fill your request. If this falls on a Friday, we need to hear from you before 10 a.m. to make sure you are covered for the weekend. Sleep can be difficult after shoulder surgery. It is difficult to lay flat and important you do not sleep on your operative shoulder. You can either sleep in a recliner or in a bed reclined on pillows. You should wear your sling when sleeping. You will rest better if you place a pillow behind your elbow when resting, as this helps prevent your arm from falling backwards. Remember to avoid weight bearing or pulling with your operative arm. Ice therapy is helpful prior to sleep. We encourage you to stay active after you get home from surgery. Walking is important to prevent blood clots and pneumonia, but do not drive until your first follow-up visit. If your job is not physical, you can resume working once your strength and concentration have improved. You can remove your sling for computer work when you feel capable. Physical therapy is an important part of your recovery. Therapy is started at different time periods after anatomic and reverse replacement for 6 weeks. After 6 weeks, the front rotator cuff tendon is healed and outpatient therapy is started. For reverse replacements, physical therapy is generally started at 3 weeks following the surgery. Before your first follow-up visit, stay focused on the exercises you learned in the hospital. It is important to keep muscles strong. Please refer to the exercises, therapy instructions, and videos provided by your surgical care team. There are several signs and symptoms that you should watch out for after surgery. If these occur, please call the office of your surgeon or the after-hours phone number provided. These include a fever above 101 degrees, if you notice drainage through your bandage, continual drainage after the dressing is removed, or any part of your incision that is open, a foul odor of the incision, extreme swelling around the shoulder, under the incision, or down the hand. Swelling in the hand is common and should be treated with elevation, but worsening swelling should be reported. Other things to watch out for include shortness of breath, persistent nausea, vomiting, or diarrhea, numbness and tingling in the arm, shoulder or arm pain that is not controlled with pain medicine. We look forward to treating your shoulder problem and providing the highest level of patient care to relieve your pain and improve your shoulder function. Thank you for completing this Washington University Orthopedics Education Series to prepare you for surgery. You or your joint coach may refer back to these videos at any point in your patient journey. Adhering to your care plan and having assistance from your joint coach will be instrumental for your recovery. Do not hesitate to contact your surgeon or other care team members with questions or concerns. Thank you.